Welcome to St. Petersburg Together. I'm your host, Janice Ford. Life can get pretty busy, and taking care of your own health can take a back seat. One annual St. Petersburg event tries to help make taking care of yourself a lot easier. Joining us today to talk about the African American Health Forum is Dr. Cedric Thornton, Dr. Kenneth Bryant, and Jada Taylor Herring. Thanks for joining us.
Thank you.
Thanks for having us.
Let's start off by telling us what is the African American Health Forum and a little bit of its history and the purpose of it.
Well, the St. Petersburg African American Health Forum was founded approximately 1987 by a group of individuals and organizations interested in promoting African American health and health education. And this is our 17th event. It's held at John Ruth Clark Health Center on the historic Mercer Hospital campus. And this year's event will be November 1st.
Right, because it's usually the second.
Yes, usually the
So
second.
it's very important, folks, to remember that it's
Right.
November 1st this year.
Exactly.
Okay.
Exactly.
Who is involved in this event?
Well, we have a host of individuals. Number one, we have about 26 African American healthcare providers, physicians, nurses, nurse practitioners, pharmacists. We have about 40 not-for-profit health education vendors will be exhibiting during the event, and we have a host of screening activities by St. Petersburg Nurses Association and the St. Petersburg Black Nurses Association, along with P-Tech Nursing School.
Okay, so there's a coalition of folk who schedule and set this up and carry this out every year.
Yes.
Are you all in need of more folks to join the coalition to help out? I know you always need more funding.
Yes.
I mean, that goes without saying.
Exactly. Right.
Funders are always needed.
Yes.
Do you all accept people coming on every year, new people coming on to help plan this event?
Yes, we do. More hands make lighter work.
Okay. What is the reason for having a wellness event like this?
Because of the problems that we have in our community, that the large gap in healthcare, especially with our people, we wanted to bring something to the community that would give our people a better chance to help with that diversity and bring about a change in our community to where they are able to be aware of what they have and what they have wrong, what they can, so that we can teach them things. And so that's one of the biggest reasons that we moved it from Bayfront to John Ruth Clark Health Center, to put it in the middle of the community so it would be easier access for those people to come to the event. And it's more of an educational event, but we also do the screenings that will help us to find some things that we may be able to help our people fix.
Okay.
And just to piggyback off what he's saying, I think one of the great things about this event is that we do have the educational piece that goes with it. Not just that we screen people and send them on their way, but we educate them on different facts so they'll understand why their blood sugar is high or what they need to do to lower it, or what kind of problems can come from having high blood pressure and different things like that.
Okay.
And people, and the main thing is, like Dr. Thornton was saying, there's such a disparity in health in the community. African Americans are disproportionately affected by hypertension, heart disease, diabetes, and all of the cancers.
Right.
We have HIV is more prevalent in our community than in other community, and the death rate from all of these diseases are higher in African American communities.
Okay. Now, let me ask you this. This is the 17th annual one.
Yes.
And as a result of having this event every year, have you all seen an increase in maybe folks getting into their doctors and, becoming more educated on these things? Is there any way to track any of that type of thing?
Yeah, I think that's that's what's lacking in this event.
Right.
In fact, we don't have a way of evaluating the event to see how effective we are. So we are partnering now with the Martha Cancer Center and their diversity department. Dr. H. Lee Green is over their diversity department and health disparity department at the Martha Cancer Center. So we're bringing them in now, and we want to develop a system to evaluate and track what's going on with this event and if it's been effective or not.
Well, that would be very interesting to see, you know, how many people actually take advantage of the information that they gather at this event and who actually get themselves in, because it's very important. I know the prostate cancer is one, and I know that we have Jim West that was up, I think, last week at council talking about this, and I can remember working with him to get the national bus or something to come down that one year it was here. So we certainly, that's on the rise in our community, I know.
Sure.
What we have seen is that we've seen that the first year or two we had 250 people to come to the event. Last year I think we had 850 or better. So we are seeing a growth that way. Hopefully this year we're looking for more than 1,000 persons to come to the event, and so that way we're growing. But as Dr. Bryant said, we're still trying to figure out a way to be able to track that.
Right.
Well, one of the benefits that I have is that I work at Johnny Ruth Clark. So with some of the patients that we've seen, what we've tried to do is for people that don't have a primary care physician or an OB person to come to, or someone for GYN, women's health care, then we try to give them the information necessary, because we're right there in the community. So they can come in and get whatever they need done.
Okay. Now, I've been participating in this event for many years, and I've been coming out, and I can see the increase of folks every year in their attendance, and hopefully it will continue to increase every year. There are a lot of vendors that you have at your event. Can we talk about some of those vendors that you have there?
Okay.
Well, we have quite a few people that come in that are vendors. One to name is from the health department. We have a young lady that comes in that does a breast and cervical program that helps people with free mammograms, breast cancer screenings, and pap smears, things like that. We also have, oh my goodness, I just lost.
We have hearing screenings. That's provided by Suncoast Medical Clinic. We have screenings with we give shots, not HIV shots, but
flu shots.
Flu shots. Flu shots.
Oh,
The
yes.
American Heart Association is represented. The Diabetic Association is represented with the exhibition booth. We have
Dentists, dental screenings.
Right, dental screenings.
Hospice comes through. We also have someone that speaks on HIV.
What about mental health?
Yes.
Okay. Because I know that that's very important, that we're kind of breaking that stigma that's associated with mental health, and I think it's very important that, you know, that also be one of the vendors or one of the representatives from that medical practice to come in and talk about that.
Right, Mr. Gerald Circuit will be making a presentation during the sessions, and also will be doing mental health screening.
Right. Well, that's very good.
We try to reach every aspect of healthcare to touch on everything, whether it be during the talks or during the screening portions. Like we have pediatricians that speak, midwives, people in OB, GYN, family practice, cancer screening. So we try to touch on every aspect of healthcare that we can possibly get into. So somebody there can say that they took something from the forum.
Okay. Who should attend?
Everybody. Everybody.
Everybody should attend.
We don't
Absolutely.
turn anyone around.
Okay.
Yeah, we got kids attend. Academy Prep have sent their kids, the fifth graders, every year for the past few years, and it's amazing to see them sit there and get something out of these talks. We had a kids program at one time, but now we've integrated them with the general program. But any age group should attend, no matter your age, no matter what your gender is, anybody can come.
Well, you know, that's wonderful. You do have a mixed crowd of people that's there every year. If folks are wanting to that they have questions if they're watching this show and they have questions. Is there any contact information that that you have?
Yes, they can call my office at 727-824-7146, and my other number is 727-560-1365.
And they could also call those numbers if they want to schedule an appointment with you.
Oh, sure, absolutely.
And why don't we, what is your field of medicine?
Well, I'm a urologist,
Okay.
and I've been in St. Petersburg for 28 years now.
All right, Dr. Thornton.
I'm a dermatologist, and I've been here for 27 years.
Okay, and if folks want to contact you, direct to your office.
727-347-6635.
Hey, Ms. Jada, we know that you are a
Midwife.
okay, and you work out of.
I work out of John Ruth Clark, and our number is 821-6701, and Women's Health Extension is 1100.
Okay, is there a cost for this event?
Absolutely not.
free.
Okay.
Free.
And since you asked that question, we also provide, well, there's a wellness walk
Right.
first thing that morning with a continental breakfast. And after the talks and the screenings have been completed, there's also a free lunch, box lunch for all registered participants.
Which is very healthy.
It is, and
Healthy lunch.
it's tasty too.
Yes, it is.
Really good.
I can contest to that.
And I guess I must mention that the Wellness Walk is a 2-mile walk. It's sponsored by the St. Petersburg chapter of nurses of St. Petersburg Links Association. And if I didn't mention that, my wife would kill me.
Yes, she would. Yes, she would.
As they should be, because they contribute a lot to,
They
to
do.
this,
They
this
do.
and they've been doing this for many years.
Yes.
So it's not something that you just started doing.
Right.
So kind of take me through the course of the day. What time do they need to get there to participate in the walk, and what should they wear, and
Registration for the walk starts at 7.
so you have to register for the walk.
Yes.
Okay.
You register for that. You also register for the event because that way you get your ticket and you're able to get your free lunch.
Okay.
So that starts at 7. 7:30 is registration for the regular event. They have, while they're doing the walk, though, we also have someone there that does line dancing for people that don't
I
want
was
to
just
walk.
going to mention that. Maybe I'll do the line dance.
Yeah, which is good exercise. And she has like 100 different line dances that they go through. I was in amazement watching them last year.
Yeah.
But
You enjoyed?
no, I was running around trying to make sure everything else was in place. So I was just peeking in and watching. But after that, then the event starts at 8 a.m. And of course, we start off with prayer. But the conversations start, and then, or did we? Is it the screenings first this year?
starts first
I'm
this
sorry,
year.
screenings 8 to 10. And then we'll do conversations where they sit and talk with the different physicians that have different things that they'll speak on. And that starts at 10, from 10 until noon.
Well, folks need to know that you could probably just walk in, but it's important to that you register, because this is how you get your ticket for your lunch and what have you,
Yes.
and you want to be able to go around and visit the vendors and listen to the lectures and stuff that's going on
Yes.
that day.
It's also important that they register because it gives us a way to track
Exactly.
the numbers
Exactly.
of participants, and that helps us a great deal.
So it's very important to sign in and get registered.
Yes.
For the run and for the event
For the
itself.
event itself.
Yes.
Okay. Now, we talk about funding and all of that. Is there opportunities for funding? If someone wants to say, wow, this is a worthwhile event, I think I want to contribute a couple of $100 or a couple $1,000.
Absolutely.
Who would they contact?
They
Don't
may-
all y'all give your numbers out.
They may contact myself or Dr. Bryant
Right.
or Jada. Anyone on the committee they can contact, and we can channel them to, because we accept all comers.
Yes.
And this is sponsored by the Minority Health Coalition
I
of
was going to ask you
Pinellas,
about your sponsors.
which is a 501c3 organization, so all donations are tax deductible, and this is sponsored by donations. And of course, it's a challenge every year to put this on.
Right.
The city of St. Petersburg has been very gracious and very helpful in giving us in-kind sponsorship. So and we have other organizations like Bayfront Health Foundation, Suncoast Medical Clinic, and other organizations that have helped fund this event.
Over the years, you've also had youth doing entertainment for you. Is that something that's going to be a part of the event this year as well?
Yes, we also plan to do that. We had last year was the first year that we had Imagination Station. It's a preschool that came in
yes,
and
I
they
know
sang
them.
for us. They sang. They did a wonderful job.
kids.
So we plan.
Yes.
Yeah, we plan to have them back again this year. But we have we've had spoken word. We have young teenagers that sing, dance, mimers.
Yeah.
We try to have them all, expose them.
Yeah, I know the Cali have been there in the
Yes.
past
Oh,
as
yes.
well, but the
Yeah.
kids from Imagination Station,
Weren't
I
they
have them
awesome?
to a few of my events every year, and they're just adorable.
Yeah.
We,
Oh, yeah.
we love to have them, and it's a good opportunity for kids to showcase
Yes.
their talents, and we do have a wealth of talent in our community.
Absolutely.
So give us some numbers again for folks to contact you. It's always very important that we give out contact information because I have a lot of people calling me saying, where is this going to be and what's the address and all of that
Yes.
stuff.
And that's 727. My number is 727-560-1365. 1365. That's the best number to reach me, and I can give them all the information possible.
Okay. Dr. Thornton,
Yes, ma'am.
your contact information.
My contact information is 727-347-6635. You can find me Monday through Friday, and if I'm not at that number, they can leave a message. I'll certainly will get it, and certainly will get back with them.
And I'm at Johnny Ruth Clark Health Center. It's 727-821-6701, extension 1100.
Is there anything else that you all would like to add about what's going to be going on today? Maybe give us a walkthrough of what folks should do once they come in.
Well, once they come in to register, and we have we changed the format just a little bit this year.
Okay.
We're going to start off with the screenings and the vendor visiting at the beginning of the morning after the classic walk that we have that's put on by the Links organization.
And all of those screenings are done inside?
They're done inside,
Okay.
yes, ma'am. We're going to have skin, feet, podiatry. We're going to have glaucoma screenings. We're going to have dental screenings. We're going to have HIV screenings. We're going to have mental health screenings. We're going to have flu shots,
Breast
BMR,
exams.
breast exams. Did I miss anything?
I don't think so. The flu shot. Oh,
Hearing,
hearing.
yes. And still working on a few others,
That's
but I'd like everybody to understand these are free screenings, so there's no fee for doing any of this. All the physicians who are doing the screenings, all the healthcare professionals who are doing the screenings are doing it gratis because they want to make a difference in the community.
Yeah.
So all we're asking is that our participants come out and partake.
Now, and they sign up for those screenings, right? Now,
Well, once they sign up for the program, they can go to any screening
okay.
area that they'd like to, and they can do all of them in turn. That's why we're having it before the program and also after the talks, so that they have two chances to make sure they get to everything they'd like to go to.
Because that was one of the things I was thinking about, and you have maybe a couple of hours before you start with the
Yes.
lectures and things like that,
Yes.
so folks
And
do
2
have
hours afterwards.
Okay,
Yes.
and 2 hours afterwards.
Right.
Okay, so that's and so after they go into the screenings, then what happens?
After going to screenings, the first set of screenings, we go back for the talks with the physicians. After actually, I didn't say this. After the talks with the physicians, participants have an actual chance to just go to directly to any physician that gives a talk and have a one-on-one contact with that physician if they desire to, and then the second set of screenings would start at that point. And after that set of screenings, that's when the luncheon would occur.
And the talks start with the talks we have started off with Assistant Chief Luke Williams will talk about social health in the community.
Right.
Mr. Watson Haynes will talk about economic health in the community, and Mr. Circuit will talk about mental health, and then we start with the physical health, such as dental health, hypertension, heart disease, diabetes, prostate cancer, lung cancer, breast cancer, and the metabolic syndrome, obesity. We have Mr. Greg Hinton as certified trainer talks about how to exercise and what the benefits of exercise. And then we have a nutritionist, Carrie Barnes, who's at John Ruth Clark Health Center. She's a certified dietitian, and she will talk about what kind of things we need to do to eat properly, eat healthy.
Well, that's
So
a full
everything
day.
is covered. Everything is covered.
You certainly do have all of the bases covered.
Definitely.
And this is such a wonderful event, and we certainly do appreciate you having this event in our community every year. With the lectures, is there a time frame for, you know, each one of these? This is quite a lineup of folks who are going to be speaking. Do they have a certain amount of time? Will they be available after they talk if people have questions? And I know that, you know, it'll be limited questions during the, you know, the lectures, but after they're finished with their lectures, can folks come up and maybe ask them questions after that?
Exactly.
Yes, each speaker has a time frame,
Right. You
quote
have to put a
unquote.
time
Right,
frame.
right.
Some adhere better than others.
Right.
Do you have a timekeeper?
Yes, we do.
We do. Sometimes it doesn't work very
Yeah, it doesn't help.
but the speakers are able to field specific questions right after
Right.
they speak, and after their portion is
Total
over,
session.
they're available for one-on-one contact with. And for those participants who miss them at right after they speak, because we're kind of trying to move the
Right.
program, we have a separate section where all the speakers are just kind of conglomerated together, so they can come and ask those questions directly to the speakers after the didactic programs are over.
Good, good, good. Again, the date of this event?
November the 1st.
Okay.
First Saturday in November.
Okay, and that has changed this year for people who may be watching.
Yes.
And they
It
say
used to be the
November the
second
1st.
Saturday.
They meant November 8th, but no,
No.
it's November the 1st.
First, yes.
Okay. Do you think that you're all going to keep it on the first Saturday, or you think that it will go back to the second Saturday?
Well, I think because the community is so used to the second Saturday, I think we'll probably go back to the second Saturday of November.
Okay,
It
but
has
this-
worked in the past.
yeah, But this year it is November the 1st,
November
the first Saturday
Yes.
at Johnny Ruth Clark Health Center.
Yes.
And the time is from 7 till 2?
2.
2.
Yes.
From 2. Anything else you want to add?
I think it's important. The research suggests that one reason we have these disparities is because the individuals have distrust in the community, and that's why it's important that we demonstrate that we have African Americans in every aspect of health, and if you're not trustful of your health care providers, then we have it covered in this community.
So there should not be any distrust at all.
No distrust at all.
Okay, but thank you
Yes.
all for, again, for joining us. And here's the contact information that's on the screen. And if you would like to learn more about what we've talked about on today's show, see you again next time. And thank you again for coming.
Thank you for having us.
you.
Thank you.